What about the patient with Alzheimer's? Is hospice helpful in Alzheimer's? I mean, these folks in some ways can't deal with the spiritual issues. In some ways, counselors may not help that much. And even from physical, maybe there aren't that many symptoms. Although studies show there's a lot more pain and symptoms that people think, but our patients, and if you don't know how to, if you're not trained, you won't know how to assess their pain or how to assess their symptoms. But let me tell you a story. Sometimes stories are best. We had a man who had Alzheimer's, who I was taking care of in a nursing home. Very pleasant man, very easy to take care of, and he was starting to decline and wasn't eating as much as we would expect, and things were going very easy actually. But it was interesting. His daughter, who lived nearby, would come occasionally, not rarely, occasionally at lunchtime, and she clearly was angry at her dad. She would feed him at lunch very abruptly, and there was an issue here. So once again, we had our chaplain and our social worker come and talk with her. And it turns out this very, very pleasant man had been a pretty bad father. And there was this anger, and there was all this stuff. And so they worked with her for a while, and there really wasn't much of a change. And then one day in this nursing home happened to have a little meditation room. They went in the meditation room and they set up a chair. It was an empty chair. And they said, imagine your dad is there. What are the things you want to say to him? And she poured out the anger, and she poured out how he had abused her brother and her, and just on and on she went. And then towards the end, she started to soften and break down. And they said, do you think you can start to maybe forgive? And then there was this forgiveness part into this empty chair. No one's there. And the session ended, and there was the tears, and there was some hugs. And lo and behold, that daughter started coming regularly. She started feeding her dad in a very kind way. In other words, hospice, and I tell this story for this reason, hospice is not about just the patient at the center. If you see a diagram of what a physician does, the patient's the key. The family is secondary. In hospice, the patient and the family are at the center. And so we don't just view the patient as our patient. We view the family as our patients. And we will give counseling to children who are in school. If it's a 2-year-old, we will be counseling to parents, to spouses, to daughter, like in this case, to sons, because when a person is dying and on hospice, everybody is involved, and we treat everybody. So that's one of the big differences about hospice care versus any other area of health care. The patient, the family is also our patient.